My name is Dr. Hal Spencer. You may remember our big conversation held back in February 2020 when we talked about being smoke-free at Chesterfield Royal Hospital. We talked with colleagues, patients and visitors, and the message that came across loud and clear was that we had to do something to stop people smoking by the main entrance and in the inner courtyard. Whilst both smokers and non-smokers unanimously agreed that something had to be done, there was also universal acknowledgement that it's extremely difficult to enforce no smoking within the grounds. This is because there are no laws to prevent smoking outside. Whilst our hospital smoke-free policy does prevent employees from smoking on site, as a trust, all we can do is ask visitors and patients not to smoke within the hospital grounds. Security cannot enforce no smoking. Of particular concern to many was the number of people smoking next to the front entrance and in the courtyard by the fishbowl, causing many staff to work in or have to pass through a constantly smoky environment. The majority view was that whilst being a smoke-free site should be the Trust's aim, it's currently impossible to enforce. It was suggested by many that a pragmatic approach to improve the current situation would be the installation of smoking shelters. This suggestion has been debated at both hospital leadership team meetings and at board, where the commitment and intention to become a fully non-smoking site remains firm, but where it was agreed that smoking shelters would support an easier, less confrontational approach to asking the public who persist in smoking by the entrances to move away from populated areas to reduce the harmful effects on staff and visitors having to walk through cigarette smoke and work in a smoky environment. The two shelters will be positioned directly near the main entrance here and at the visitors' entrance by the education centre. The smokers are not for use by staff, and the hospital's executive remains committed to supporting patients and staff to stop smoking. For staff, nicotine replacement therapy, such as gum or patches, can be purchased in our pharmacy, and a referral to Live Life Better Derbyshire can be carried out. And for patients, we offer all our inpatients smoking cessation advice and nicotine replacement whilst they're in hospital. I know our approach about smoking shelters won't be popular with everyone, but having listened to staff, we do need to try something. I hope this will help the unsatisfactory current situation, but if it doesn't, we shall rethink. Thank you for listening.